A 26-year-old female, Hindu by religion, single, uh, residing in Bengaluru, HR, manager by profession, coming from middle socio-economic status, uh, and yeah, she lives in a combined family with her parents and her elder sister. This person came to our OPD. She came when our previous director, Professor Gangadhar, used to sit in the OPDs, and she visited the OPD on Feb 2020, just before the COVID-19 pandemic. And when she visited, the main complaints that she had was low mood for last 2 months, lack of energy. She also had crying spells and suicidal ideations, difficulty in sleeping. There was also an associated anxiety. She was finding it difficult to cope with her work, and the absentees in the office had increased. Most of the time, she would remain at home and would not feel like going to work. The task which she used to enjoy, actually going to work and doing that HR work, she used to enjoy before, but she was not anymore able to enjoy that. Pre-morbidly, she is well adjusted. She was well adjusted, and she reported some performance anxiety and low self-esteem even before that, and a little, low self-confidence. Otherwise, birth and development was normal. Academically, she was average, and occupationally also was well adjusted. This particular symptom, the episode was sudden, and we observed that it had a uh, um, uh, it was a precipitating factor, where 2 months ago she had a failure in her relationship, and after that she started getting into low mood. The person also, says that she had a loss of appetite, difficulty in sleeping, especially early morning awakening was there. And when she came to the OPD, she wanted to explore whether she can manage herself without medicine. So she was not very much inclined to take antidepressants. And our professor B.N. Gangadhar gave her an option that she can uh, try yoga, if she doesn't want to take medicine. So what happened is, without starting her on medicine, on in Feb 2020, we she met me in the yoga center. I interviewed her, and we decided that we have to give her certain energizing, activating set of practices. She was trained in a module. She underwent 3 supervised sessions with us. Then we recorded the module, the audio. Uh, the practice audio was recorded and shared with her, and she was asked to continue the practices. And just, Feb 2020, and that was the time, within few weeks, COVID-19 pandemic started, and suddenly she couldn't, go out. And in March, after 1 month, she called me on my phone, and she was crying, and she looked very depressed. And she said that I'm not even able to do the yoga that you prescribed, you know. So then we decided that she should take antidepressants, and we started her on 10 mg of escitalopram, and she took that medicine, which started from April. No, yeah, April 2020, the medicine was started, 10 mg, and then the pandemic continued. And when she started taking medicine, I remember that around 6 to 8 weeks after starting that medicine, she said that now she's able to do yoga. She got enough energy, to practice yoga, and she started practicing yoga. And we, at that time, we also started tele yoga. Zoom came up, and before that we were not using it. So we started teaching her yoga through tele mode, and she continued to practice it regularly throughout the pandemic. And in Feb 2021, like from April, you can see that around 8 months, she continued to take 10 mg. And after that, in Feb 2021, she said that she feels much better, and she has been able to overcome those symptoms. And of course, we also used to have discussions once a week on certain philosophical aspects of yoga, the purpose of life. She was a Krishna devotee, so we also channelize her energy, her towards prayer and all those dimensions of yoga as well. And we assessed her prakriti, and it was observed that she was a kapha dominant personality, and the earth and water elements were more. And that is what in psyche also it made her go more towards the tamoguna, towards the makara. And that is why her stress manifested in the form of depression. And then those lifestyle changes were also advised, which can help reduce the kapha dosha. So with these lifestyle changes, dietary changes, and yoga, she continued. After 8 months, we reduced her escitalopram to 5 mg. And then she continued that till June. So Feb, another, you can say approximately 5 months, she continued 5 mg escitalopram. And then she felt confident, and the psychiatrist who was treating her also felt confident, and her medication was completely stopped. But she was encouraged to continue practicing yoga. She was doing the practices on her own. Only weekly once we were supervising it on Saturdays. And she continued to practice yoga. And then she joined her job. She started working after pandemic. And she also reported some self-transformative experiences. She really felt that she got a new lease of life. She felt very much, connected to the science of yoga. And later on, she actually decided to get herself trained in the field of yoga. She went to one university here, which is known as Swami Vivekananda Yoga University, and did a 1-month yoga course, and got so much into yoga that she is now pursuing her higher education masters in yoga, and has become a yoga therapist, and is treating other patients who have depression. And she keeps referring patients to us and keeps asking about how she has to modify her yoga therapy. So she has now become a full-time yoga therapist. And this is the person that we are going to discuss now. And she is going to come in here. So let us listen from her, her own experiences. And then you are free to ask your questions also at the end. So now Soumya is here with us. Soumya, can you hear us? Am I audible, Soumya?
Yes, sir, you're audible.
Yes. Thank you so much, Soumya, for joining this session and sharing your experience with us. So, I would leave it on you. Kindly just tell us about your journey. When we met you in 2020 Feb till now, how has your journey progressed?
The journey has been it was very tough initially to become that stronger person. But once this is completed, now I can say I've become a more wiser person, more responsible, more mature, more strong, emotionally strong, more detached, also, I can say, and spiritually connected as well.
Thank you so much, Soumya. So, Soumya, we see that we have been following up with you for a long time now. In the beginning, when you came to us, you had certain symptoms, and in those symptoms, in the beginning, 1 month you tried yoga, but the symptoms were so overwhelming that you could not practice yoga. Am I correct?
Uh, yes, sir, you're correct. Yes.
So, so when you were trying yoga, what was preventing you from practicing yoga when in say Feb March 2020?
Yeah, so I met you in the month of Feb 2020. Unfortunately, there was lockdown now, just after that. So I couldn't come there and offline take your sessions. So when I started taking it online, I was so restless. I had no mood to take my mat and sit on the mat, and there was no motivation. It's like even if I take my yoga mat and sit, I would just sit, look at the wall and stare at the wall for hours together and just cry. Sometimes I wouldn't know why I'm crying. And 24 hours I will have anxiety. So the anxiety was along with me like a shadow that time. It was like I didn't even know how it feels without being having that feeling near your chest. How I don't know how, not in a particular place. I don't know to put it up in words. It's like every day morning you get up, you don't want to get up at all. You don't want the day to start. And um, even if there are friends who wants to meet you, you have no interest in that. Your appetite is gone. And when I wanted to start yoga, m- my my uh, my heart would say, okay, you should do that. That's for your good. Um, that's you will become better if you do that. But then my brain will bring all the thoughts from my past. I'll have guilt, I'll have regret, I'll have anger in me. I'll just go blank for some time. Then the big question I'll have is why me?
Mm, mm,
So when that question comes, I'll just start to cry. Sometimes I'll not even know why I'm crying. I'll be like, okay, now everything is done. Now I'm fine. My family is there. But again, I'll cry. It's sometimes it is so frustrating that I don't know why I'm crying. So because of that frustration, I'm crying. At least I should be able to think, okay, for this reason I'm crying. There are few minutes I won't even know why I'm feeling this anxious. Then I'll take a whole day to think about it. Okay, this was what was bothering me, this thought. So I was crying. And there was I was not able to breathe properly. A lot of that calm, slow breathing. Uh, I never took a calm and slow breathing for years during that time. And always my heartbeat will be fast. And even if I'm middle of a crowd, I'll feel so lonely. I'll just go to my mom and say, I just want to go home. I'll either want to go and sleep on her lap or just go into my room, shut the doors, and just sleep there, not pick anyone's call, nothing. But fortunately, one thing which was going well in my life that time was my work. Um, my managers and my colleagues there, they understood I'm going through some bad phase and they supported me, but that was just one thing which was going well. Otherwise all this thing is happening. I know yoga will cure me, I know yoga is the solution. Still I was not able to start it. And I know Hemant sir also used to call me and every time tell me, you come on, you take the mat, you go, you start, and still it's like only on the call I'll say okay sir, but when I disconnect the call, I'll just keep my phone somewhere, I'll go sleep and cry. And there are times I've just sat on yoga mat and slept there and cried. And it's like you can't even move a glass of water which is in front of you. You know you're thirsty, you want to drink, your hand won't go there and pick it up and drink. Yeah.
yes, yes, Soumya. So, so this, suggests that it was a moderate to severe, level of depression at that time, and we had done her HAM-D scoring also, and it was 30 when she came to us, and when she was in this situation, when we tried to start yoga in that condition, you know, yoga didn't work, and her situation worsened. Scores further went down, and came down to 32 when she came down. Then we thought that we have to start medication. So Soumya, then what happened when you started taking medicine?
Okay, I remember, sir, there were some instances happening at home and all these things. I immediately called you on March 30th, same year, 2020, and I said I'm getting suicidal thoughts, sir. I was aware of that because you had already told me that you might get some such thoughts. So immediately I have to come and tell you or tell someone, not hide and continue with that thought. So I immediately called you and I said, and you suggested me to take Nexito. Um, when I started taking the tablet, it suddenly my mood used to be very good. I'd be very happy. When I say very happy, the bad thoughts or any such traumatic incidents because of which would trigger me easily, I would never get the thoughts. Or even if I got the thoughts, it'll be like my mind is just acknowledging those thoughts but not holding on to it. It just comes and goes without affecting me. And I'll be so happy. I'll be smiling. There were many, almost 2 to 3 years. My parents had never seen me smiling and laughing. Sometimes weeks together, they wouldn't hear my voice only at home. They would come and search if I'm there in room because I would not talk at all. But after the tablet, this was the changes. I would definitely say the mood was, and actually the tablet was something which motivated me to start yoga.
Hmm.
Even that morning, 6:50 a.m. Mental health, the batch, which is still going on in Imans. I used to attend that. Again, to attend that in Feb, I was not at all. I used to just keep it on and just sit and watch. While watching, also, my eyes will be on that, my mind will be somewhere else with all the bad thoughts. But again, the tablet gave me that motivation. It gave me that energy, physically also energy to start doing it. So that time I started attending that morning sessions.
Wonderful, wonderful. So you continued 10 mg of escitalopram for almost 8 months, is it? 6 to 8 months.
Yes, next year, 2021, Feb 4th, it was reduced to 5 mg. Until then, I took the 10 mg tablet.
Yes. So it was your decision to reduce it to 5 mg or clinician's decision, or did you request that?
No, I didn't. I came there to the OPD. So there were Ayurvedic doctors, there was a psychiatric doctor, and Hemant sir and a therapist also was present. So they all, before I entered the room, they had a discussion on my case. My father was also there along with me. So
Hmm.
until that 1 year, constant follow-up was done. Because of COVID, that 1 year I was not able to go to Niman. So this follow-ups were done online. And anytime I felt anxious, anytime I felt low, I would immediately call Hemant sir and say this exactly, precisely. I would say, this is what I'm feeling. And uh, also after I started 10 mg, and I was motivated to attend this morning 6:50 a.m. session, I started having more interest on yoga. So I found a personal trainer, one of my friend's sister, and she used to come home every day,
Okay.
morning 5:30, and teach me. But that I wanted because I was interested in asanas, the advanced asanas. So that again helped me a lot. Hemant sir had actually suggested me to do that, but at the same time, I found her also, and she gave me classes for 2.5, 3 months every day morning, completely from kriyas to advanced asanas, everything I learned. After that, I started practicing it myself. Again, the tablet was helping. Again, there used to be days where I'll feel very low and I'll not attend her class. Um, Especially during the sunset in the evening time, I've noticed I used to feel very low, feel like crying. I didn't like the sunset. I always liked the sunrise. I used to feel like just shouting if I see the sunset, and I'm like, no, the day shouldn't end. Either the day shouldn't end or the day shouldn't start only. So that was the things I wanted that time. So that helped me. And then again, I started practicing it myself. Then after reducing the tablet to 5 mg, again Hemant sir suggested me to take the classes on weekend as well, and he suggested me a yoga instructor. She used to take online weekend classes, and weekdays I used to do the mental stress management sessions held by Nimans in the morning.
Yes. And then when did we completely stop the tablet?
On 12th June 2021. Yeah, 12th June 2021.
Well, June 2021, we completely stopped the tablet. And now it is 24, you know. So
Yeah,
almost 3 years now. After
yeah,
that, did
yes.
we need to start the tablets any time in these last 3 years after stopping it?
No, not at all. No.
Not at all. So, usually in depression, we see that there are chances of recurrence when a person has taken antidepressant for a longer time and he stops it. This is how we call it as recurring depressive disorder. But here we have a 3-year follow-up, of a person who was able to come out of antidepressant. Generally in psychiatry, we know when to start a medication, but we do not know when to stop it, how to stop it. So it just goes on, because when we stop it, there are high chances that the problem recurs if other lifestyle aspects and underlying stress is not addressed. So here yoga worked as a tool, you know, to, and another very important thing to learn here is that when the patient had severe symptoms, yoga did not work. Modern medicine had its own value, and it helped yoga and yoga helped modern medicine. So it is in this way that both yoga and antidepressant acted complementary to each other, complementing each other ultimately towards patient welfare. So definitely in the yogic way only, there was some psychotherapy that was also going on. There was a continuous interaction between me and Soumya that used to go on, and she used to ask, deeper spiritual questions. Now also she comes and meets me and has her own questions. So definitely it was not only practice, but there was a component of psychotherapy in the Indian psychology way that was also going on. So, Soumya, would you like to talk about that aspect?
Yeah, sir. Um, when you spoke about symptoms, I have to tell this. Initially, the symptoms were like I used to have anxiety since school. That anxiety, I used to get scared if I have not done my homework because there was constant comparison between a brilliant student and me. So that was in my head from primary school. So again, the comparison happens between siblings at home. That's when the anxiety used to start. Okay, I'm not good enough. I'm not good enough. And then I was very sure that I'm not good enough because people around you start telling that instead of encouraging you and motivating you since childhood. So I used to have, now I remember that, okay, that was anxiety. Just because I didn't submit on homework, I used to feel like I don't want to get up early in the morning. What I felt during the depression days. Then there was a major panic attack kind when I joined college, an institution for my higher degree. I just went for a week. Till today, I don't know why I left. I used to sit and cry every day in the class. This was in 2015. I felt I'm not into this. There are such students who come from around the world here, such a big institution. How can I fit in? How will I pass? How will I study all this? And when I came home, there was nobody to motivate me and say, it's okay, go. They said, it's okay then. If you feel you cannot go, it's okay, leave it. I started feeling more comfort in not being strong. And then later on, there came my first job. When I took up that, again, my confidence, I had zero self-esteem. My confidence went down. I used to think I'm not fit enough for this job. Again, if I share that with anybody in my family or anyone, I don't blame them for that, but there should be someone to say, no, you have to give a try. So I started to convince myself that I'm not good enough. And then when there came marriage talks, I was not able to make a decision there. I was feeling all this doesn't make sense, and nobody should force you for certain decision. And again, there were back to back some 2, 3 incidences. Until then, all I had is just anxiety, and I used to cry. But after these incidences, I don't say I from childhood I'm a little sensitive person. I have a lot of patience. I don't say no. I don't shout at anyone. I'm not adamant. I'm not stubborn. I easily adjust. So after these incidences, my symptoms in the year 2019, I used to bite my tongue while sleeping because when I get angry, I'm not someone who will shout. So I used to do anything. Uh, I think biting my tongue was not in my control. I was not able to control that. So I think that was the way I was putting out my anger or controlling it. And there was one time when my parents had an argument because of me. They started to have an argument and kind of have a fight. So I shouted very loudly. I was biting my tongue, closed my eyes. I held my hair, pressed my ears. I went to a corner in the room and I started shivering and just, I wanted to just go into that corner. Then my sister saw this, and before that, I had told everyone that I feel like this. I need to see a psychiatrist. But it's very important also to family to understand, but they didn't because they don't know what depression is. It is like people should be more educated about this. They said you're making reasons not to get married, just bringing up various reasons. But that day when my sister saw all this, she said, "No, this is not her. This is not at all her. She's." I was not. I was scared to even touch my sister when she came closer to me. I felt they are all there's someone else. I lost that connection. And then we went to several doctors. It did not help. And then I met Dr. Gangadhar sir here in Nimans. And when I met him, he had so much of patience to sit and listen to me. I wasn't telling anything. All I was doing is just crying there early in the morning in his office. Then my sister explained to him, and he said, we treat depression in 3 ways in Nimans: tablet, counseling, and yoga. I think you're in the stage where yoga would help you. And he just wrote a letter and said you can go meet Dr. Hemant in the yoga center. And that day I went and met Hemant sir. And the same day, I think I went there around 11. Until evening, I was there. He explained why depression happens. See, whatever happened with me, I'm telling today, it's not a big deal. I've not gone through hell or anything like that. There are people who've lost their loved ones, their leg, their hand, their children. I'm blessed to have this life. Still, these things did affect me and made me so broken, and that pushed me to depression. I asked him why it is happening to me. There are so many people who go through more than me. It's all since your childhood, it all counts. How you're being molded, how strong you are. I was not capable enough to handle all that. I needed a outside support, and that support is yoga. And he explained me and my sister completely why it is happening. And yes, it can be cured. You're in a right place. This is the right path. And how Surya Namaskara helps, how your breath helps in controlling your mind. So that day I was like, okay, I'm in a right place. And after that, symptom of biting my tongue, shivering, I think that was the only incident where that level of symptom happened. After starting antidepressants, I used to only feel anxious, of course, that loneliness. I used to cry a lot. But yeah, eventually when that is gone, now I don't even know how anxiety, I don't remember how it feels.
So that's wonderful, So anxiety is something that was a part of your personality, and you say that you don't even, know that how it feels like to be anxious. That's wonderful. And Soumya, please also tell us about your interest in yoga and what are you doing currently?
Um, After I stopped my tablets in 2021, again Hemant sir told me this is the time things can reoccur. So do not skip even one day of your practice. And the instructor whom he had suggested me, I took Saturday, Sunday her class, and morning I used to do my own practice. Also, the Niman's morning mental health session. So that went on. After that, I changed my company. I was working as in HR in corporate. Then 2000. 22 April, I changed my company. So the next company I went, I had a lot of pressure. I didn't have time for yoga. I was not the level of practice I did these many years. I was not able to do it in when I was in that company, maybe weekly once or something. And yet it did not reoccur. In fact, I started becoming more wiser. I was good at my work there. All this I feel is because not just practice, but also the craving in me to learn more yoga, to know more theoretical knowledge about it. And these many years of practice also made me spiritually so much connected. Now I quit my job, my corporate job last April, uh, and I did my YIC from Esvasa University, yoga instructor course. And then now I'm working as an yoga instructor. I take personal therapy classes also. And from Jan 24, last Jan, from Yasvyasa University, I've joined my MSc in yoga therapy in distance. So uh, I don't know. I have 7+ years of experience in corporate, yet the fulfillment I get by taking one class of yoga, and after the class, when the client they come and say, I feel very calm, I feel very light, thank you. I feel I've given back something to yoga which gave me this life today.
Oh, that's amazing. Wonderful, wonderful. So inspiring, Soumya. And yeah, last question to you. What are the yoga practices you think that helped you the most?
Pranayama, sir.
Oh,
Without any second thought, I'll say it is pranayama. Asanas also did help. Asanas motivated me to do it. Like if I'm not able to touch my toe to the floor in halasana, I'll be like, I have to do it. Come on, tomorrow. So it's like I'm competing with myself. But when it comes to calming my mind and mm, it was pranayama. I can feel now also whenever I have headache, I start doing anulom vilom wherever I am. Even if I'm in a flight, I start doing. I can feel my headache is reducing. It's like I don't know how it helps others. I suggest everyone you have headache to start doing Nadi Shuddhi Pranayama. It's amazing. And also while doing that, it's very difficult to have that thoughtlessness, blankness in your mind. Of course, I have not gone to that level, but I've learned one thing is not to acknowledge the thoughts. Just let the thoughts come and go. And to even get to that stage was so difficult. I think now after my YIC, I'm able to feel that, okay, let the thoughts are just coming and going. I'm just looking at them. I don't hold on to them. And I think uh, I used to feel very low during the evening, as I said, sunset. So the instructor whom you suggested, sir, she used to she just suggested me to do the right nostril breathing a lot, and I used to feel very active. First thing I started seeing changes in my life after yoga is my sleep. There were so many years I never slept at all properly. I used to sleep early morning, 5 o'clock. Daytime I'll not get sleep because of anxiety. Nighttime I'll not get sleep because of the thoughts. So the sleeping pattern were completely fine, and I can say Nadhanusandhana and Anulom Vilom.
hmm.
These are two practices which I do even now. Because of those vibration in Nadhanusandhana, it makes you feel so nice, so divine. You start to feel very divine.
Yes. So thank you so much, Soumya. Soumya is soon getting married, and wish her all the very best. And she is very busy. She has to do a lot of shopping now. So, uh, my best
No,
wish.
sir, no matter how busy I am, anything regarding mental health from Nimans, from you, I will make sure I am available because this marriage, what is happening, this marriage was a very traumatic thing for me. I would get dreams where that them getting me married to someone whom I don't want. I had such dreams. I had actually I decided I'll not get married. You know that I had shared this with you also. So a person with who had decided I'm done with it. The yoga is my life. I don't want marriage. So someone who said yes, and that too, it's a love marriage. I was not open to even talk to guys. So I was so okay. I thank Krishna for all this happening in such a good way. And for anything from Nimans, I can never say no, because this life, what I've got, is because of you and Dr. Gangadhar sir. So I should thank you. Anytime, any calls, I will be available.
Thank you, Soumya. And it is really, really motivating and inspiring for us, when people like you, come back to us and share this very, very valuable feedback. There are so many psychologists here, there are more than 50 psychologists, there are psychiatrists who are treating such patients day and night. And your story will definitely, definitely motivate them, will inspire them towards the utility of yoga. So our Nimhan psychiatrist, Dr. Naresh, has commented. He wants to thank you for sharing, and you have shared a lot of intimate details with us quite openly. So this really, really we appreciate. So towards the end, already a lot of time has passed, so we will not take too many questions. Only one question, short question from Revati. Yes.
Congrats, Soumya ji, for going through all this and coming out so beautifully well and giving back to the society.
Thank
I
you.
wanted to ask one particular thing, other than yoga, like the spiritual practices that you had, which helped you. Can you detail on it, ma'am?
You're asking, other than yoga, what are the practices which helped me, is it?
Yes, ma'am. One thing I understood is you were Krishna devotee. So,
Yeah.
was there any other thing suggested to you?
I used to read a lot of books, Krishna books especially, and I used to sing, which I had stopped during. I mean, I don't practice with a teacher now, but I used to at least sing and record something for myself. I had completely stopped that. And I can say something which more motivated is I talk to Krishna. I consider him as a friend since childhood. I don't know any other god other than Krishna. Since I remember, it's him. So every time I want to connect, I just say, okay, this is happening. I don't know where to go. You just take me. I surrender myself. And once you surrender to him, it's like you're surrendering to everything and everyone, because he's everyone. If and anybody who goes to a doctor, a psychiatrist, first thing they should have is a trust on them. I had that trust on Hemant sir that day, and that day also I made up my mind that I should come out of this, and the only way to do that is by surrendering. I didn't know that that mindset of mine was a surrenderness. I didn't know. Now I know that. Then I used to think, okay, I'll just do whatever he says. I trust him. This is how it is. But that connection started happening because of yoga. Other than yoga, actually, no. Now I think I didn't have any such thing. I just have a hobby of reading books. I read a lot of books, and I used to sing. But other than that, this is something helped me more than that, I can say. And some classes after Yoga Nidra, I used to feel very refreshed, and so many questions in my mind would be answered after Yoga Nidra. I can't explain to you in words how, but it's like it's the feeling. I would understand, okay, that day what I thought, okay, this is that. I don't have to further think about it. So Yoga Nidra sessions helped me a lot.
Okay, thank you, ma'am.
Thank you, Soumya. So I will not take more of your time. So my, namaskar to you. Thank you. See, all the people here are, congratulating you and sending you more and more strength. And I pray for you and wish you all the very best in your life. Thank you.
Thank you. Thank you, sir. Thank you, everyone.
Bye.
Sir, can I ask?
You can discuss, Madam Soumya. We can, let Soumya go.
Yeah.
Yeah.
No, with you only, sir.
Yes.